Good afternoon. Hello, everyone.
Bonjour à
Bonjour à
toutes
toutes
et
et
à
à
tous.
tous. Today, I'd like to talk about
Aujourd'hui,
the importance
j'aimerais vous
of our
parler de
built environment to
l'importance de
healthy
notre
living and
environnement
healthy
bâti afin
communities,
d'assurer une vie saine et
especially
des
during the
collectivités en
pandemic.
santé,
But
surtout pendant la
first, I'll
pandémie.
begin with the
Mais
usual
d'abord, je vais
updates.
commencer comme d'habitude par vous
There
donner les
have
tout
been
derniers chiffres. Il y a eu
134,924
cas de
cases of
COVID-19 au Canada,
COVID-19 in Canada, including
dont
9,163
9 163 décès.
deaths. 88% of
Des
people have
personnes
now recovered.
infectées, 88%
Over the past
sont maintenant
week,
rétablies. Au cours de la dernière semaine,
47,806 people were tested
47
daily,
personnes ont
with
subi un test de dépistage chaque
1.1% of
jour
people
et
testing positive.
1,1% ont
An
reçu un
average of
résultat positif. En
618 new
moyenne,
cases have
618
been
nouveaux
reported
cas ont été
daily
signalés
during the
quotidiennement
most
au
recent
cours des
7
7
days.
derniers jours.
Our built environment,
Notre
being the
environnement
physical
bâti,
spaces where we live,
c'est-à-dire les
work,
espaces
study,
physiques
and
où nous
play, have a
vivons,
significant
travaillons,
role on
étudions
our
et
health.
jouons,
These
a une grande
environments,
incidence sur notre
designed
santé.
with
Ces
public health in
milieux,
mind,
s'ils
can
sont conçus en
benefit our
fonction de la
mental
santé
health,
publique,
our access to
peuvent favoriser
exercise,
notre santé
nutrition,
mentale,
and
notre accès aux
healthcare,
ressources en
and
matière
our
d'activité
exposure to
physique,
infectious diseases and
d'alimentation et de
hazardous
soins de santé,
materials.
ainsi que de
Changing our
notre
physical
exposition aux maladies
environment
infectieuses et
is
aux
a
maladies
powerful way to
dangereuses.
improve health. For example, over the last century, improving
Il est
sanitation,
donc très
infrastructure
utile,
planning, and addressing
à
residential
titre
overcrowded
d'exemple, au cours du
reduced
dernier siècle,
infectious disease
d'améliorer
rates
les
in
systèmes
Canada.
sanitaires.
I was pleased when the Government of Canada
J'ai
recently
été heureuse
announced
de voir
the Canada
que le
Healthy
gouvernement du
Communities
Canada a lancé
Initiative to
l'initiative
help
canadienne
governments
pour les
and community
collectivités en
partners
santé,
advance the
afin
goal of
d'aider les
healthier
gouvernements et
living
partenaires
environments during
communautaires
the
à contribuer à la
COVID-19
création de
pandemic.
milieux de vie sains
This
pendant la
initiative
pandémie de
could support
COVID-19.
local projects
Cette
to
initiative
adapt
pourrait
public
faciliter la
spaces to
réalisation de
enable
projets
people to
locaux
more
visant à
easily follow
adapter
public
des
health
espaces
measures,
publics pour
while
permettre aux gens
encouraging
de
and
suivre
providing
plus facilement
opportunities
les
for
mesures de
them to
santé
be more
publique,
physically
tout en les
active and
encourageant à faire
improve
plus
their mental
d'activités
health.
physiques et à améliorer leur santé
Over the
mentale.
summer, we saw many
Cet
examples
été,
of
nous avons vu de
municipalities
nombreux
adapting
exemples où des
public spaces
municipalités
in
ont
ways that
adapté
encourage
les
outdoor
espaces
social and
publics de
physical
manière à encourager
activities.
les activités sociales et physiques
Many
en plein air.
communities closed
De
selected
nombreuses
streets to
collectivités
traffic
ont
to
fermé
allow
certaines rues à la
pedestrians and
circulation pour que
cyclists
les
to
piétons et les
exercise
cyclistes
outdoors
puissent faire
safely.
de l'exercice en plein air en toute
Restaurants,
sécurité.
bars, and cafés
Les
set
propriétaires
up
de
or
restaurants,
expanded
de bars,
outdoor
de cafés
seating
ont
so
aménagé
that
des
their
terrasses
customers
ou
could
les ont
dine safely
agrandies
at
pour que
least
leurs
2
clients
meters
puissent prendre un
apart.
repas en toute sécurité
And I expect we
à au
will
moins
see
2
more
mètres les uns des
innovations
autres.
this
Et je
fall
m'attends
that
à
will
ce
help
qu'il y ait
us live
d'autres innovations
healthier
cet automne
and be
pour
socially
cet
together
automne
while
qui
physically
nous aideront à
apart.
mener une vie plus saine et à
But still,
maintenir
the
des
most
liens sociaux
important
tout en
reminder when out in
respectant
any
les
public
distances
space is to
physiques.
keep up
La chose
our
la plus
public health
importante à se rappeler
practices
lorsque
of
l'on
physical
se trouve dans un
distancing,
espace public
frequent
est
hand
encore
washing,
de
and
maintenir
wearing a
les
mask
mesures
when
de santé
physical
publique
distancing is
comme la
not
distanciation
possible.
physique,
Thank
le
you.
lavage de mains fréquent et le port du masque lorsque la distanciation physique n'est pas
Bonjour.
possible. Merci.
Oui, j'aimerais vous parler
Good
de
day. Today,
l'importance de notre
we'd like to
milieu
talk about
bâti
the
pour
importance of our
assurer
built
une vie saine
environment
et
to
avoir des
healthy living
collectivités en
and healthy
santé,
communities,
surtout pendant la
especially
pandémie.
during the
Mais
pandemic.
d'abord, je vais commencer, comme
But first, I'll
d'habitude,
begin
par
with
les
the
eu 134
There have been
924 cas de COVID-19 au Canada,
134,924 cases
dont
of COVID-19 in Canada,
9
included
9,163
9,163 deaths. 88% of people have now recovered.
Au cours de la dernière semaine,
Over the past week, 47,806 people were tested daily,
chaque jour, et 1,1%
with
ont reçu
1.1%
un
of
résultat
people
positif.
testing positive.
En moyenne, 618
An
nouveaux cas ont
average
été
of 618 new
signalés
cases
au
have been
cours des
reported
7
daily
derniers
during the
jours.
most recent 7
Notre
days.
milieu bâti, c'est-à-dire
Our
les
built
espaces
environment
physiques
being the
où
physical
nous vivons,
spaces where we
travaillons,
live, work,
étudions et
study,
jouons,
and
a une
play
grande incidence sur notre santé.
have a
Ces
significant effect
milieux,
on our health.
s'ils sont
These
conçus en
environments,
fonction
if
de la
designed
santé
with public
publique,
health in mind,
peuvent
can benefit
favoriser
our
notre
mental health,
santé mentale, notre accès aux
as well as
ressources
our
en
access
matière
to
d'activité physique,
exercise,
d'alimentation et de
nutrition,
soins de
and
santé,
healthcare,
ainsi que notre
and our exposure
exposition
to
aux
infectious
maladies
diseases
infectieuses
and
et aux matières
hazardous
dangereuses.
materials.
La modification de notre milieu physique est
Changing
un
our
excellent
physical
moyen
environment is a
d'améliorer
powerful way
la
to improve
santé.
health.
À titre d'exemple,
For
au
example,
cours du siècle dernier,
over the last
l'amélioration des
century,
systèmes sanitaires,
improving
la planification
sanitation,
d'infrastructures et la
infrastructure
prise de
planning,
mesures à l'égard
and
du
addressing
surpeuplement dans
residential
les habitations
overcrowding
ont permis de réduire les
reduced
taux de maladies
infectious disease
infectieuses au
rates
Canada.
in Canada.
On est heureux de l'initiative
I was pleased.
canadienne
We
pour
are
des
pleased when the
collectivités en
Canadian
santé que le
government recently
gouvernement du
announced the Canada
a
Health
annoncé
Communities Initiative
récemment afin d'aider les
to
gouvernements
help
et les
governments
partenaires
and community
communautaires
partners
à contribuer
advance the
à la
goal
création des milieux
of
de vie
healthier
sains
living
pendant la
environments
pandémie de
during
COVID-19.
the
Cette
COVID-19
initiative
pandemic.
pourrait
This
faciliter la
initiative could
réalisation
support
de
local
projets locaux
projects
visant à adapter les
to
espaces
adapt
publics
public
pour
spaces
permettre aux gens
to
de
enable
suivre
people to
plus
more
facilement les
easily
mesures de
follow
santé
public
publique,
health measures
tout en les
while encouraging
encourageant à faire plus
and
d'activités
providing
physiques
opportunities for
et à
them
améliorer
to be
leur
more
santé mentale
physically
et en
active
leur offrant
and
des occasions
improve
de
their
le
mental
faire.
health.
Cet été, on a vu de nombreux exemples
Over the
où
summer,
des
we saw many
municipalités
examples of
ont
municipalities
adapté les
adapting
espaces
public
publics
spaces
de
in
manière
ways
à
that
encourager les
encourage
activités
outdoor social
sociales
and
et
physical
physiques en plein air.
activities.
De nombreuses collectivités ont fermé certaines
Many
rues à la
communities closed
circulation
selected
pour que les
streets to
piétons
traffic
et les
to allow
cyclistes
pedestrians
puissent
and
faire de
cyclists
l'exercice
to
en plein
exercise
air en
outdoors
toute sécurité.
safely.
Les propriétaires de restaurants, de
Restaurants,
bars
bars,
et de cafés
and
ont
cafes
aménagé des
set
terrasses
up
ou
or
les ont
even
agrandies pour
expanded
que
outdoor
leurs clients
seating
puissent prendre
so
un
their
repas
customers
en
could
toute
dine
sécurité
safely
à au
at
moins
least
2
2
mètres
meters apart.
les uns des autres. On s'attend à ce qu'il y ait
And we
d'autres
expect we will see
innovations
more
cet
innovations
automne
this
qui
fall
nous aideront à
that will
mener
help
une
us
vie plus
live
saine et
healthier
à maintenir des
and be
liens
socially
sociaux
together
tout en
while
respectant
physically
une
apart.
distance physique. La chose la plus importante à se
But
rappeler
still, the
lorsqu'on
most
se
important
trouve dans
reminder
un
when
espace
out
public
in
est
any
encore
public
de
space
maintenir
is
les
still
mesures
to
de santé
keep
publique
up our
comme la
public health
distanciation
practices of
physique,
physical
le lavage
distancing,
fréquent des mains
frequent
et
hand
le port de
washing,
masque
and wearing a
lorsque la
mask when
distanciation
physical
physique
distancing
n'est pas
is not
possible.
possible.
Merci.
Thank you.
Merci, thank you. We'll now open the line to questions. Vous pouvez poser vos questions dans une des deux langues officielles.
Ask
We
your
ask that
question
you
in
limit
either
your,
official language.
Questions to one to start and a follow-up. For those asking questions in the room, we ask you approach one of the standing microphones. Operator, over to you for questions on the phone.
Thank you. Please press star one if you have a question. Veuillez appuyer sur étoile 1 pour toute question. Our first question is from Mia Robson from the Canadian Press. Please go ahead.
Yes, good afternoon. As late as March 10th, Canadians were still being told by you and by the health minister that the risk of COVID-19 in Canada was low. We're hearing now that there were reports much, much earlier in the United States and potentially even in Canada that this was a far more serious illness than many Canadians seem to think. Why were we still being told in mid-March that it was a low risk to get COVID-19?
So I will start. So ever since we got information about the cluster of pneumonia in Wuhan, domestic preparedness already began to escalate. We developed lab testing. We actually identified our first cases towards the end of January and have been asking for preparedness. And I don't know if people recall, I mean, in February, we were saying the window for preparedness is closing. People need to prepare. We've been preparing with the provinces and territories. I think some of the risk assessments was at that moment in time, the domestic transmission was risk was deemed to be low. That doesn't mean that something wasn't happening outside of Canada, but we didn't have that many cases, nor did we have sort of extensive local transmission. So that was just referring to the local domestic risk for someone who doesn't have any risk factors. At the time, it was sort of moderate for people who may have underlying medical conditions, for example, a sort of very short soundbite of the bigger risk assessment. But that was the origin of how we position the risk at that moment in time. But as we've seen with this pandemic, things change very rapidly. And so very soon after the date, I think that you had identified lots of public health measures evolved and escalated at every level of public health in Canada.
Do you think if we had...
C'est Dr. New. Peut-être je peux répéter en français la
Perhaps I
réponse
can give you an answer
oui,
in
c'est
French.
sûr, on a
Yes.
reçu le premier
Clearly,
bilan ou le
had the
rapport
first
d'une
reports
pneumonie d'origine
about a
inconnue de la
pneumonia
Chine
of
à la fin du mois de
unknown origin in
décembre
China as of the month of December 2019.
Le premier cas a été
first
signalé au
case
Canada à la fin
was
du mois
raised
de
in
janvier.
Canada at the
Ce qui
end
était intéressant,
of January.
on était avec nos homologues des provinces et territoires. On a
conversations
mis
with our
en
counterparts
vigueur
from the
la communauté
provinces and
consultative
territories,
spéciale. On
and
était en
we
train de se préparer.
created a special
Mais,
constitutive committee. advisory
la
committee,
raison pour
rather.
laquelle on a dit
And the
en
reason
général,
why
le
we
risque pour les
said
Canadiens
that
était
generally speaking, the
pas
risk for
très
Canadians
haut
were not
mi-mars,
very
c'est parce
high
que
mid-March
avec les
was
cas qui
because
ont été signalés à
given
nous
the
autres à
cases
l'échelle nationale,
that we had internally in
c'était
Canada
très faible. Moi, je me
domestically,
souviens, c'était
it
comme une
was quite
centaine,
low. I
peut-être
think we had
moins
about
que 200
100,
cas
fewer
signalés
than
à
200
travers le
reported
pays.
cases throughout the
Et c'est
country.
aussi intéressant.
Recall the
Au début,
details at the
les premiers cas
details at the
signalés au
beginning. The
Canada
first
étaient des
cases
voyageurs
reported
qui
in
sont venus
Canada were
de la
travelers
Chine.
coming from
Mais
China.
après, avec les mesures
But
qu'on a mis en vigueur
with the measures
à nos
we
aéroports,
implemented at
avec
the
le dépistage, tout
airports
ça,
and the testing,
en fin de compte, il y avait sûrement comme une
in the
dizaine
end, there
de
were
cas qui sont d'origine de la Chine. Et puis,
only about 10
après,
cases
ce
originally
qu'on a
from
vu,
China,
c'est
and then we found
les cas aussi des
that
voyageurs,
the
ils
cases
sont
from
arrivés des autres pays
actually,
du monde.
these were
Je
travelers
pense
that
qu'au
were coming
Canada,
from elsewhere than
peut-être
China.
c'est nous autres qui ont signalé le
And
premier cas
perhaps
lié
in Canada,
avec
we
un
may have
voyage à
been
l'Iran.
first
Aussi,
to
on a
note
vu,
that a case was
après,
linked to
les
Iran,
voyageurs
travel
qui
to
sont
Iran.
venus d'Italie.
And then there
Et
were
finalement,
travelers coming from
jusqu'avant
Italy.
mi-mars,
And then
on a
just before
commencé
mid-March,
à voir ici
we
au
started
Canada
seeing here in
qu'il y a
Canada
des Canadiens
that there were
étaient
Canadians
avec la COVID-19 et le
who
seul
were
voyage
infected.
était aux États-Unis.
And their only
Pour
trip
nous autres, ça, c'était vraiment
abroad
quelque
was
chose
to the
très
United
important
States.
parce
To
qu'on a
us,
beaucoup
that
de
was
liens
really
avec les
significant because we
États-Unis,
have
beaucoup des
very
Canadiens.
strong
Et aussi, je
relationships
pense
with
avec le relâche
Americans.
scolaire au Québec
And
aussi,
also with the issue of the school
avec les
breaks
autres
in
provinces et
Quebec, for
territoires au
instance, and
Canada,
the other provinces
se
and
sont passés, je
territories.
pense, comme mois de
We
mars,
know that
mi-mars.
that
C'est donc
happens around
à ce
March,
point-là
mid-March,
qu'on
and that's
sait
the
que
point
c'était
at
vraiment
which
quelque
we
chose
realized,
qui
we knew
est
it was really something,
comment dire, vraiment une épidémie, une pandémie partout
a
dans le monde.
pandemic. We realized
Et
it
avant
was a
ça,
pandemic throughout the
c'est
world.
pourquoi on a dit le risque était
And that's
à un
why
certain
prior
niveau
to
parce
that,
que
we said the
le
risk was
nombre
at
de
a
cas
certain level
signalés au
because
Canada
the
était
number
très
of
faible.
reported cases in Canada was
And
low.
the follow-up?
Question suivie.
Yeah, we know that the first warnings about cruise ships, I think, were issued on March 9th. The first warning for non-essential travel outside the country, I think, was on March 13th. If we knew that the risk of this illness was as severe as we seem to believe it was now in February, why did we wait so long to tell people about travel and warn people about what to do when they were returning or not to go at all?
Ces mesures de précaution, par exemple.
Well, I think our initial travel advice was focused more on China and then moved to, I believe then it was Iran and then Europe. So we've been issuing travel health notices all the way up to that point. And then around that, the time frame that you just talked about, we actually issued the very first ever issued before pandemic travel health notice, which is every single country in the world. And that was quite a significant move for travel health notices, level 3 alert, avoid all non-essential travel, even before any of the other countries announced any cases. So it was a very broad advice to every country in the world. So we were not waiting for, a country that hasn't announced any cases to sort of provide that advice. So that's how the travel health notices evolved.
Next question.
Prochaine question.
Thank you. Notre prochaine question est de Jérôme Bergeron de Radio-Canada. À vous la parole, please go ahead.
Jérôme Bergeron from Radio-Canada.
Oui,
You have the floor.
bonjour. J'ai une question.
Question, yes, thank you. I have a
Concernant
question.
les nez qui coulent, il y a beaucoup de parents qui ont des frustrations et incompréhensions.
The sound is
Au
not
Québec,
sufficient to allow
par
for
exemple,
accurate
on dit que
interpretation.
le nez qui coule, ça peut un deuxième symptôme pour ne pas aller à la garderie.
There is talk of
Puis, en
stuffed
Ontario, on dit, avec un nez
noses
qui coule,
in Quebec.
on ne va pas à la garderie pour ce qui est des enfants. Qu'est-ce que vous,
The
vous
interpreter
recommandez
regrets, but
pour
the
les
sound is
enfants
not
qui ont
clear
présent
enough to allow for
symptômes,
accurate interpretation. The answer
avec
will be
l'automne qui
interpreted.
arrive, le nez, ça coule très, très facilement. Alors, qu'est-ce que vous leur recommandez?
Merci pour la
Answer.
question.
Thank you for your question.
C'était vraiment, comme on dit, un enjeu
How can I put this? This is a
actuel.
really
On a
current
même
issue.
discuté ça au
We
sein
discussed this issue
du comité consultatif
among
spécial.
ourselves in
Je
the
pense,
among our
en
group
fin
in
de
the
compte,
special
tout le monde
advisory
regarde
committee.
la
At
science
the
et
end of the
qu'est-ce qui
day,
se
everybody
passe.
is looking at the
Mais,
science and following what's
c'est
going
vraiment, comme on
on.
dit, la
Of
gestion
course,
de risque et aussi la
risk
tolérance de
management
risque, c'est
and
vraiment,
risk
ça
tolerance
reste une responsabilité
is
des médecins hygiénistes
a
aussi à l'échelle
responsibility
locale
that
de chaque
falls
province et territoire.
under each
Moi, je peux
province
pas
and
commenter
territories
pourquoi au Québec on a
Chief Public
décidé
Health
de
Officer.
voir une certaine politique concernant les
I
enfants
can't
peut-être,
really comment
qui
on
ont
why
né,
Quebec
qui coulent, et,
has a policy
pourquoi en
about children
Ontario,
with
on a
runny
pris
noses
peut-être
and
une
where
autre
in
décision.
Ontario there
Je
might have
pense
been a
que c'est
different
même
decision.
dans une province,
I think that
peut-être
even
les
within a
décisions pour
province,
qu'est-ce qu'on fait avec les enfants,
decisions as to what
ça
to be,
peut même,
what we do
on peut
with
même avoir
children
une variation
may even
entre
vary
les administrations
from
dans une province,
administration to
peut-être la ville de
administration,
Montréal
even
comparée à
for instance, say
Lac-Saint-Jean, ça peut être différent.
the city of
Donc, je
Montreal
pense que
versus the Lac
c'est
Saint-Jean
vraiment,
area may
quelque
have
chose
they
qui
may
est
have different
mieux
approaches.
géré
This is something
avec
that
le
is better
contexte et aussi
managed
l'épidémiologie
given
et tous les
context,
autres
epidemiology,
facteurs et
and all the other
considérations à
factors and
l'échelle locale.
considerations that need to be taken into account at the local level. Follow up?
Oui, et de votre côté, donc,
Question,
je ne
yes.
vais pas comparer, mais vous, c'est quoi vous dites? Dès qu'un enfant a un nez qui coule, on fait quoi avec cet enfant-là?
To the question that was inaudible to the interpreter.
Ça dépend. Pour moi, je suis aussi un parent et
The answer to
ce que
your
je peux
question,
dire,
it
c'est,
depends. You know, I'm
si
also
on
a
a un
parent.
enfant qui
If you have
tombe
a
malade,
child who is sick,
il faut peut-être
then
examiner c'est quoi
you have
tous
to
les symptômes.
see what the symptoms are, all of the symptoms. If the child has a runny nose, the child also have other symptoms like a fever. The most important thing is always to speak to your health professional, your doctor, to get an assessment, a medical assessment of the child. What we discussed with our counterparts from the provinces and territories is
l'automne et l'hiver qui
that given the fall
sont en train
and the coming fall and winter that
c'est
are
important que
at our doorsteps, it's important to have a testing approach for sick children, not necessarily only for COVID-19, but for any other infections. If it's not COVID, then we can at least diagnose, say, the flu or another virus. I think it's important to remember that this is something that needs to be managed. Public health and laboratories can do a proper diagnosis, and it's important to decide in that respect what we do with sick children. It's not an easy answer that I can. If you're a parent with a sick kid, the first thing to do is to go see your doctor to get an assessment done.
Thank you. Next question.
Prochaine question.
Thank you. Merci. Our next question is from Ryan Timothy from National Post. Please go ahead.
Question du National Post.
Good afternoon, Dr. Tam.
Bonjour, Dr. Tam.
I'm working on a story about the quality of data that the federal government receives on COVID cases. There was some documents submitted to the House recently about this, mentioning that in terms of data on things like race and ethnicity of COVID cases, on housing type, on some of that more granular information, the federal government is either not quite getting it yet or just starting to get that information. I'm wondering if you think that the quality of data that the federal government gets from provinces about COVID cases has hindered the response at all.
I think public health responds even with a certain amount of uncertainty and incomplete information, and local and provincial public health have their information to act. But we would, of course, like it to be sent up as fast as possible to the federal level as well, just so that we can provide the national analysis and picture. So I think at the beginning, the race and ethnicity data was not collected consistently. It has improved, but we're making it one of the priorities with provinces and territories right now to enhance that data collection. And also in trying to look at location is sort of, as you've seen, some cities have already done it, like Toronto, look at whether specific areas of the city are more impacted, which may be linked to then social economic factors. So, and that's another area that we are trying to fill in terms of getting the information right now from jurisdictions. So I think things are accelerating, but we have been getting, of course, the basic core set of information on not just the numbers, but the age, the sex, and some very key elements that we were able to use to coordinate and collaborate on the national level. But at the local level, they had the data that they needed in order to, of course, affect public health action.
Any follow-up?
Yeah, I'm just wondering, there was also a system developed through Canada Health InfoWay called Panorama that was designed to be a public health surveillance system. I understand it really just hasn't been used very much during the pandemic. Do you think that system might have helped?
Well, provinces and territories, some uses Panorama, others do not. So they've adapted the system to what their needs are. So there is not a single system as such. But people have used Panorama or the equivalent to Panorama at the provincial and local levels. And they do have to submit then to us on a daily basis using the system that they have. So I wouldn't say that has hindered that not having Panorama there's definitely different systems in different provinces. And sort of going forwards from a public health systems perspective, it may not be the technology or the platform that is an issue anymore. We have new technologies to essentially pull data from different kinds of platforms. I think we need to look at the next iteration of how to make sharing of data easier in Canada. And some of the Panorama, I think, had many different aspects to it. Some of them were more for case management, which is very much more relevant at the local level.
Thank you. We'll now take questions from the room. Radio-Canada.
Yeah. It was so cooperative here with our colleagues. I want to ask you, this is the end of the first week of this great experiment of sending Canadian children back to school. And I'm wondering what you're watching for in coming days and weeks in terms of trends and numbers to see whether or not this is causing across the country a substantial increase. What kind of numbers are you going to be looking for, when, and at what point, if those numbers are changing dramatically in that cohort of people who are going to school, would your advice about returning to the classroom change?
I think that at the federal level, we provide guidance, and that does have to be adapted to local situations. So I would say that just as the pandemic has resulted in many different regional realities, so would the going back to school, because I think what happens with cases in the school right now is reflective of what's happening in the community. So depending on where you are, we might expect different numbers. So what my colleagues are doing right now is looking at systems of posting numbers that from different schools, and right now what they're detecting are sort of singular cases, maybe two. Haven't seen much transmission in the school situation. So what I would like to see is those numbers reported, not just from schools with cases, but also the denominator of how many schools are actually doing okay. Secondly is whether if there were more than one case, there were two or more, is having feedback from provinces as to whether they think transmission happened in the school or elsewhere. And if it did happen in the school, what we've done is we've set up provided another tool, which is like a case report form, where people will do a more in-depth description of what exactly happened in the school. So that data will be reviewed as well collectively and shared amongst the chief medical officer, so that we can know how best to manage the situation. So, sort of really examining individual outbreaks, particularly at the beginning. And obviously, the age group of the cases, right now, we've detected this escalation in numbers in the 20 to 29-year-old, 30 to 39-year-old next age group because people are returning to work or they may be doing other activities. As children return to school, we'll be watching to see if the age group, this sort of distribution in Canada changes. And so that's another factor. And we'll be looking at whether lab testing positive rates, but in that age group also shifts. But I think that there will be no blanket approach across the country because you really have to look at the local situation. What my colleagues are trying to do is not to take a blanket approach to the closure of schools, but as much as possible be as precise and as targeted as possible within that community. And they'll be watching to see what else is happening in the community. If something else is driving the outbreaks, the most important thing to do is to address those transmission sites in order to protect the return to school. So they'll be balancing that as well. But I don't expect I will have sort of blanket recommendations, but it would be sort of a collaborative response and learning from each other. And the most important thing about this pandemic is that we have to just keep learning and adjusting our guidance as we go along. Thank you.
I want to get your opinion, not so much as a health administrator, but as a physician, about vitamin D. There has been some research suggesting that people who are deficient in vitamin D have much worse outcomes, possibly higher infection rates from COVID-19. We also know that people with darker skin, people of color living at northern latitudes also have higher incidence of vitamin D deficiency. I'm curious whether you think as the days are getting shorter, should Canadians start thinking about supplementing their vitamin D levels?
So I think that's not just a sort of COVID issue. I mean, vitamin D is a key component or nutrient that supports the metabolism in our body, if you like. And so vitamin D deficiency itself is not good for your health in general, and there's actual medical outcomes of that. It is something that people should look at in terms of their diet, whether they've been going out. Yes, people with darker skin or people who cover themselves more. I think I would advise also just touching base with your family physician about just to review these factors. For COVID-19, I'm aware that right now there's some observational studies. Some of them are retrospective, looking at whether if someone was, comparing groups of people that were deficient the year before in vitamin D and those who were not, and then seeing what the outcomes are, which gives us, I think, at least when you looked at the study itself, what it's suggesting is that we actually need more prospective clinical trials if we're going to sort of sort this question out. And I know that there's actually quite a lot of trials that with vitamin D that is ongoing right now. So I will look forward to the results of those.
Radio-Canada.
Oui, bonjour, Philippe Vincent, Radio-Canada. Première question sur le confinement. La France a réduit sa durée de confinement de 14 à 7 jours. Est-ce que c'est une mesure qu'on envisage? Est-ce qu'on va réduire à 10 jours? Est-ce que on garde le 14 jours encore, puis c'est un chiffre qui va durer tout l'automne, ou faut s'attendre à ce qu'on puisse réduire cette période de confinement?
In the fall, for instance, can we expect that there might be a drop in the number of days people have to be
Je ne sais pas si je comprends bien qu'est-ce qui se passe en France.
L'isolement, l'isolement.
Sorry, I'm not sure I understood your question.
L'isolement personnel.
Isolement versus confinement. You mean for the cases that have been confirmed?
Après un voyage ou après une diagnostic?
Answer, do you mean after the trip or after a diagnosis with COVID-19?
Test sans symptômes.
So a test with no symptoms.
Moi, je peux
Answer.
plusieurs aspects. Si
There are a number of aspects to
on
this.
parle
If we're talking
d'une
about
personne qui arrive
an
au Canada,
individual coming
on
to
sait la
Canada,
période d'incubation.
we know
Ça
that
peut
the
être
incubation
jusqu'à
period
14
can
jours.
be
C'est
up
pourquoi,
to 14
comment
days,
dire,
and that is why
la période de quarantaine
the
obligatoire pour
quarantine,
les arrivés au
mandatory
Canada,
quarantine for people
c'est 14
arriving in
jours. Ça
Canada,
reste
arriving to
toujours
Canada
comme
is
ça.
14
On
days,
a
and
eu
that's
la
not
question
changing.
même de la
From
période
Quebec,
d'isolement pour les cas
what they call
confirmés. Si on a
isolement
déjà
or lockdown
eu
for
un diagnostic
confirmed
de la
cases. If you
COVID-19,
have a diagnosis of COVID-19,
avec l'évidence et les données probantes
with
jusqu'à date,
evidence,
on dit que
with the
quelqu'un
evidence we
qui est
have before
maintenant
us so
en bonne
far,
santé,
a person
qui a
who's
guéri,
healthy, who has
10 jours
recovered,
après le début
10
des
days after
symptômes,
the start
on
of
peut considérer
symptoms,
comme
we could
rétabli.
consider that
Si on a
that
été en
person
contact, en
has
fait, c'est ceux qui ont
recovered.
été en contact
Question.
avec un
So,
cas de la
sorry, it was about people who would have been in contact with a case
vous
of
êtes en
COVID-19.
En contact, OK.
Oh, answer, you mean,
quelqu'un qui a
a
le- qui a été
contact of the person.
diagnostiqué.
Question,
OK, oui.
a contact of a person
En
who
général,
has
c'est
gotten
même
a COVID
principe au
diagnosis.
Canada. Je
diagnosis.
pense, on
Answer
considère que
yes.
la
I think that's the
période
same thing in
d'incubation,
Canada. We
ça peut
consider the
durer jusqu'à
incubation
14
period
jours.
to
Donc, si
last
on est
potentially
en
up to 14
contact
days. So if you're
d'un
a
cas
contact
confirmé,
of a
en
confirmed
général, on considère
individual,
cette personne peut-être à risque de
individual
développer
case,
la
then that contact
COVID-19 jusqu'à 14
could
jours après.
develop
Je voulais vous entendre
COVID-19
sur ce que
up to
vous
14
avez mis
days
cette semaine
afterwards.
sur les nouveaux-nés.
Question. I'd like to hear what
Il y
you
a
have to
un
say
risque
about
pour les bébés,
newborns.
les
There
nouveau-nés.
apparently is a risk to newborns.
Qu'est-ce que les parents aujourd'hui qui attendent des
What
enfants
about
doivent
parents
faire
who
avec leur
expect,
bébé,
who
avec
are
leur nouveau-né?
expecting?
Si,
What
par
should
exemple, ils ont
parents
des enfants
do?
qui vont à l'école, des
Let's
enfants qui
say
vont au
they also
secondaire,
have older children
la
who go to
famille, la
school or
bulle.
kids who go to
Qu'est-ce qu'on
high
fait avec les
school.
nouveau-nés?
What do you do with this bubble and what do you do with newborns?
Moi, je te dis en
Answer.
général, tous les,
Generally
comme-
speaking,
et
I
pour
would
les
say
nouveau-nés,
this.
aussi pour les nouveaux parents, je pense
For
que c'est
newborns and
vraiment
for
une
new parents, you know,
période
it
stressante.
really
Je
is a
pense
stressful
que
period.
toutes les bonnes pratiques d'hygiène,
Having good
même
hygiene,
avant la COVID-19,
even
ça
prior
peut
to
être,
COVID-19,
sont
I think
vigueur.
that
Si
still
on a
applies.
aussi des autres enfants
If there are
qui vont à
other
l'école,
children going to
c'est toujours
school,
important de
it's really important
souligner le point, hey, des
to
autres
really
enfants,
say
important de
it's
se laver les mains
important to wash your
fréquemment.
hands
Faut pas peut-être
frequently,
toucher
not
le
touch
nouveau-né,
the
le
baby
bébé, avant de
without
devoir
really
se laver les mains,
making sure
des
you've
choses comme
washed
ça.
your
Je pense
hands,
que
that type of thing.
c'est aussi important peut-être
I think it's also
minimiser le
important
risque et les
to
opportunités
reduce the risk and opportunities
pour la
for
contamination,
infection.
peut-être avec le bébé,
Perhaps
on limite les visiteurs, des choses
limit
comme
the
ça.
number of
C'est
visitors
comme,
with
pour moi,
the
c'est pas
newborn to the
quelque chose
newborn.
de spécial. C'est
I
la même
don't think
chose
it's anything
avec
new,
les
really. It's not
bulles
special.
sociales. On
I
va
think it's the
limiter
same thing
peut-être
with the bubble.
le nombre de
In a way, you
personnes
want
en
to
contact
limit
avec
the
la
number
famille,
of
aussi
people
les
in
nouveau-nés.
contact
Je
with
pense que
the
c'est les mêmes
family
pratiques.
and with newborns.
Distanciation
I think the same
physique,
thing
le port
applies.
de masque,
Physical distancing, wearing
des
a
bonnes,
mask,
comme on dit,
good
étiquettes respiratoires.
respiratory etiquette, as people say.
Merci. Next
Thank you.
question, Presse canadienne.
Oui, bonjour, Lina Dib, la presse canadienne. Je
Question.
sens que vous allez me dire ça dépend de la situation
I know you're going to tell
locale,
me
mais
that
le
it
Québec vient de
depends on the local
décider
situation,
d'interdire
but
les
Quebec
karaokés.
has just
J'aimerais avoir
prohibited
votre opinion
karaoke.
scientifique sur
I'd like to know about your
l'exercice lui-même de
opinion
karaoké. Est-ce qu'il peut
about
se
the
faire de
exercise
manière
of karaoke.
sanitaire,
Can that type of thing be
sécuritaire en
done
temps de
safely during a pandemic?
Merci pour la question.
Thank
C'est
you
une bonne
for the
question.
question. That's a good question.
Dr. Tam et moi aussi,
Dr.
avec
Tam and
tous
I,
nos homologues, les
with all of our
scientifiques, les
colleagues
chercheurs, on
and
continue à
scientists,
examiner
researchers,
l'évidence
counterparts
scientifique
are continuing
qui
to
continue à évoluer aussi avec les
examine
données
the scientific
probantes.
evidence that
Ce
is
qu'on voit maintenant,
evolving based
il y a
on
quelques activités, aussi quelques
further
situations
evidence.
qui,
There
comment
are
dire,
some
peut-être,
activities, some
augmentent le
situations
risque
where there is an
d'être
increased risk
infecté avec le
of
virus.
infection.
C'est pourquoi on parle aussi en français des trois,
That's why
comment dire, pour moi c'est comme
we
en anglais, c'est
say
the 3 C's.
the 3 C's. We talk
Oui,
about the 3
en
C's.
français, je pense,
In French,
il faut éviter comme des
I think they talk
des
about
endroits bondés,
avoiding
des espaces clos,
places that
et
are
aussi le contact
crowded,
étroit.
that are
Pourquoi?
closed
Parce
off and
que
close
on sait
contact.
avec le virus, on
Why?
sait sûrement
Because
que
we know with
c'est,
certainty
la
that with this
transmission, c'est
virus,
aussi avec les
we
gouttelettes.
know
Mais
that the
maintenant, on
transmission
parle aussi
is
peut-être
through
avec les
aerosol.
gouttelettes plus petites,
We talk
plus
about
petites.
perhaps
Même on parle
smaller
de quelque
aerosols
chose, on s'appelle
even.
des aérosols. Et c'est ça avec
So droplets and aerosol. So given the experience people have had in other countries, like some activities like singing or screaming very loudly, this could increase the risk of transmission. And it is why, even in bars, people are told not to speak loudly, and in my view, karaoke it's almost impossible to reduce the risk because the activity itself is singing. And we know that based on other experience, there have been outbreaks relating to choirs in churches and groups where people were singing together. So I think karaoke, I personally think that it's an activity that is, this is at an unacceptable risk at this point.
The risk of karaoke. I think all the scientific evidence in terms of transmission we talked. There's certain activities that we are certainly seeing lots of sort of experiences around the world, and that includes sort of shouting and singing. And so if that certainly has been sort of shown to be a sort of a higher risk activity, in my view, I think karaoke, just the nature of karaoke, which involves singing, I don't think at this point you can consider that a safe activity. Only in my house, alone.
CCTV. La suite de ma question à moi, c'est donc,
and so to follow up on my question, should it be prohibited throughout Canada? Would that be your advice? And what do you say to the bars that say, hey, you know, we clean the mic every time someone sings, there is plexiglass in front of the singer. Why would it be impossible to reduce the risk?
Answer.
As to why it's impossible, I think people can put a number of measures in place, but based on experience, what we've seen in the city of Quebec, bar owners put everything else in place with plexiglass and a 30% capacity limit, and yet there was an outbreak. So that's why we think Quebec, based on scientific analysis and evidence, it's prohibited. Karaoke is prohibited in public spaces. If you're alone at home, that's not a problem. But for the rest of Canada, I think public health authorities in each province and territory are aware, they're examining and analyzing the evidence. It's their own responsibilities and their own decision as to how they manage risks in their own jurisdiction. It's not for us at the federal level to determine this. What we think is that basically it's the same principle in BC, given what happened with the number of cases and the rise in the number of cases in BC. They took very targeted measures in BC. That is the right course of action. Really to analyze the epidemiological situation locally, instead of having a blanket policy for the entire province. It depends, perhaps. There may be some way for the authorities at a local level to target their measures based on the context and the epidemiology. Thank you.
We'll now take questions from the phone. Operator, to you.
Thank you. Again, please press star 1 if you have a question. Veuillez appuyer sur étoile 1 pour toute question. Our following question is from Brian Lilly from Toronto Sun. Please go ahead.
Hi, Dr. Tam. I'd like to hear from you on this. The health minister, Patty Hajdu, said yesterday that the decision to silence the Global Public Health Network was not made at the political level. She said it was an administration decision made by the Public Health Agency of Canada. I'd like to know if you consider that accurate, and if so, who made the decision to shut down or silence the Global Public Health Network, and why?
Et pourquoi?
Just to clarify that the Global Public Health Intelligence
Alors,
Network
le réseau
continue to
mondial de
function.
renseignement de santé publique
So
a
I
toujours
think
continué
with
à
the
fonctionner.
expert group, that sort
Le
of the
groupe
independent
d'experts,
review, we're just trying to look
qui est
at
en train de faire un
exactly
examen indépendant,
what
est en train
actually
de
happened.
savoir, essayer de
As I
comprendre ce qui
said,
s'est
the
passé exactement.
team continued to
Comme je vous l'ai
function.
dit,
I got the
l'équipe
information that
était
I
toujours
need
en place. J'ai
when
reçu
the
les informations dont j'avais
initial
besoin.
press, I think media article about the Wuhan pneumonia cluster came along. Because I get a GFIN report every day, I got the report that I needed. The question was about whether there's a sort of alerts should have been sent out in addition. And that's the bit that's going to be reviewed. And so I think, I look forward to gaining a better understanding too as to what, what the process was. But so it's that's the facts as I know it at the moment, and I will look forward to the review.
Brian, follow
Okay, so again, then, who made the decision to change? You say that the organization is still going on and you got the information, but alerts weren't sent out. Who made that decision and what was the rationale for it?
Qui a pris la décision
again, I have to be careful that I don't get the facts wrong, but I know that there are managers within the branch that manages the GFIN network. And it was a question about the need to have a heads up and a review process, for the managerial levels to be notified if an alert needed to be sent out. So that's basically the information that I know. And we will be looking forward to strengthening things as needed. So I just don't want to get ahead of that review.
We'll take one more question from the phone and then we'll go back to the floor. Operator?
Thank you. The next question is from Kelly Grant from the Globe and Mail. Please go ahead.
Hi, this is for Dr. Tam. We've seen some continuing increase in the case counts across the country. Ontario passed 200 today. BC set a record yesterday. At what point will you grow concerned enough about the growing case counts that you would advise, even though I know the individual jurisdictions will make their decisions, but that you would advise some rolling back of opening restrictions?
So, again, it is dependent on the local epidemiology. The idea is to not let things get to a point where the activity is not manageable. By that, we mean, I do think we need to monitor not just the numbers every day, but the speed of acceleration, the reproduction number, etc., all those indicators that we've been talking about. But one critical factor is the ability to sort of detect and track and deal with contact tracing. So some of the key indications would be whether that was still being managed and that the local public health capacity hasn't been exceeded, and of course the hospital acute care capacity. But I think initially it would be the public health capacity that would be vital. So I think right now, we know the epidemiology involved a younger cohort. I think anytime we're going to start seeing long-term care facility outbreaks, seniors being impacted and an escalation in serious outcomes, that's another indication that more needs to be done. But I think the concerted effort of public health is to try not to go back as much as possible. So these targeted approaches are being indicated right now. But I think all along with this pandemic is about adaptation. So I think it's not a simple level at which someone is going to roll back a particular measure. But we just have to watch it really carefully so that things don't escalate to the extent that we can't manage.
On veut juste que la situation soit gérable, reste gérable. Question de suivi.
These indicators.
Question inaudible.
Sorry, could you repeat that again?
Pourriez-vous répéter la question?
Sorry, I'm just wondering if Dr. Tam can just speak to how she's feeling about our current state, with the case counts and with some of the other indicators she just talked about, like basically how worried
à ces augmentations de cas. Est-ce que vous êtes inquiète?
Well, I think there's 4 biggest provinces, I think, where we have seen some cases. They appear to be in urban situations in terms of current escalation. So, under those circumstances, in those locations, I think I am concerned, and so are other medical officers of health. So this is a really critical period of time, as I've said, I think in the last couple of weeks, where we have seen a steady, slow but steady increase in the cases. So now is the time to not be complacent and to sort of keep up with our vigilance. We do not want this to escalate further to the point, as I said, where there's a rapid escalation and we are not able to trace, track. And so I would say in certain areas of Canada, what we're seeing is concerning, but there is something that we can do right now to slow it down.
Thank you, merci. Le devoir.
Hélène Buzetti, du devoir. Monsieur, j'aimerais bâtir sur la question de ma collègue tout à l'heure. Bon, vous avez dit que les karaokés, vous trouviez que c'était moyennement approprié, mais vous avez aussi dit qu'il y avait 3 contextes qu'on devait éviter, les endroits bondés, les espaces clos et les contacts étroits. Dans ce contexte, j'aimerais vous demander, qu'en est-il des bars en général? Pas juste le karaoké, mais des bars. Est-ce que c'est encore une bonne idée de les garder ouverts, considérant que la plupart du temps, on va là pour aborder de nouvelles personnes, pour flirter, pour boire de l'alcool, écouter de la musique fort. Est-ce qu'on devrait les garder ouverts?
Should they stay open?
Merci pour la question.
Answer,
Je
thank
pense
you for your
que
question.
le karaoke c'est vraiment, comme on dit, une activité spéciale.
Karaoke
parce qu'on chante et
is really
c'est sûr
quite
que
a
c'est une-
particular
c'est
type of
un
activity
risque
because
élevé.
people are singing
Concernant
and it
les
is a
bars et
higher
les
risk.
restaurants, c'est
As
quelque
to
chose.
bars and restaurants being
Je pense
open,
que les autorités de santé publique,
I think
vraiment
public
à
health
l'échelle
authorities locally
continuent à
really
surveiller étroitement.
continue
Parce
to
que
keep a close eye on the
avec
situation.
les cas qu'on voit
Given the cases,
partout, clairement seulement
it might not
lié aux bars et
only
restaurants.
be, the case might not only
On
be
voit aussi
related
que
to bars
c'est,
and restaurants. We see
dans
that
plusieurs régions,
in
c'est
some
peut-être-
regions,
c'est
in several
peut-être plus
regions,
important qu'est-ce qui se passe dans les, comme on dit, les fêtes privées.
the spread may be
l'intérieur,
happening
et c'est pas quelque chose,
in private
comme
parties,
dit,
in
contrôlé,
a private context.
avec, comme les bars et restaurants.
And this is not
Donc, je
something
pense
that can be
que
controlled like
c'est-
bars and
c'est,
restaurants.
c'est peut-être que
So
trop facile seulement blâmer les bars et
it
restaurants. Je
may
pense
be
qu'en
a bit of an
général,
easy target
ce qu'on voit,
to try to
avec toutes les
blame bars
mesures
and
de santé
restaurants,
publique
given all the health,
qui sont, je
public
pense
health
que,
measures
en général, en
in
vigueur dans les
place
bars et restaurants, la
in bars
distanciation
and
physique
restaurants,
avec les tables.
physical
On ne peut
distancing
pas, comme dit, chercher
between
une boisson au
tables.
bar, il faut rester
You
à la
can't
table. Et
go
le
up to the bar to
serveur
get a
va
drink.
prendre à la
You have to
commande.
sit at the bar,
Je
at
pense
your
aussi,
table, and
dans
a waiter will
plusieurs
come to
régions,
get your order.
on ne peut pas chanter, et on ne peut pas
In
danser. Il
several
faut
regions, you
vraiment
can't sing or
rester
dance. You really have to
comme dire, à la table. Je pense
stay at
que
your table.
le contexte pour même aller au restaurant, au bar, je pense que ça a
Even
changé
the
un peu. Je pense
context
que c'est
in going
peut-être
to
que plus
restaurants
un
and
groupe
bars
d'amis,
has
peut-être
changed. It's
on
usually a
choisit une
group of
table dans le
friends.
coin
Perhaps you might choose
tout le monde
a table
reste
at the
dans
corner,
leur, comme leur propre bulle
and
sociale.
everybody stays within the bubble.
Donc, je pense qu'avec qu'est-ce qui sont, avec les règlements actuellement en vigueur,
Given the
je pense
current
que
regulations
c'est
in
toujours une
place,
question de
I
surveiller
think
dans les
it's
jours,
important
les
to
semaines prochaines, qu'est-ce qui va se
keep
passer. Parce que aussi
monitoring
avec,
what's happening in the coming days and weeks.
avec l'automne et
Again,
l'hiver,
given the
je pense
fall
que
and
tout le monde au
the
Canada, on
coming
va rentrer
winter,
tous à l'intérieur.
everyone will be
Je
indoors
pense
more
qu'il
often.
faut faire attention
We need
aussi,
to be
qu'est-ce qu'on
careful
fait
what we're
dans
doing
nos maisons, à domicile, à l'intérieur, pas
home,
seulement qu'est-ce qui se passe dans les bars et restaurants.
inside, not only
Vous parlez
in
toujours
bars and
de bars et restaurants
Question.
comme si
You
vous ne
refer
faisiez
to
pas de
bars and
distinction entre
restaurants
les
as though you
deux.
are not
Est-ce qu'il
making
n'y
a
a pas un
distinction,
risque
drawing
plus élevé
distinction
avec les
between
bars
those two.
qu'avec les restaurants?
Isn't there a greater risk in a bar than in a restaurant?
Pour moi, c'est un établissement où
To me, it's an
on peut boire et
establishment where you
manger.
can drink and
Oui,
eat.
c'est sûr, peut-être.
Yes,
C'est-
sure, perhaps
on peut faire une distinction,
you
mais
can draw that distinction.
D'après moi, ce que je vois, c'est difficile des fois parce qu'il y a des restaurants aussi avec une partie qui est une
you
bar.
have restaurants that
Si on parle
include a part of the restaurant that is
d'une bar, il y a
essentially
aussi
a bar.
plusieurs
And
bars
then
qui offrent
there
aussi
are a number of bars that also offer
des menus, aussi
menus
des repas. Donc,
and
pour moi,
meals.
c'est vraiment difficile à
So
faire
to
la
my mind,
distinction.
it's
Je pense
difficult
que
to draw a
c'est
clear distinction.
peut-être plus facile de parler
It
des
may be
établissements,
easier to talk about
des entreprises où
establishments
on sert les
where
boissons et aussi les repas. Je pense que
they
c'est
serve both
peut-être trop difficile de
drink
faire la
and
distinction
food.
spécifiquement
Really, it's
entre les bars
difficult
et les
to
restaurants.
really specify and
Merci.
distinguish
Thank
between
you.
bars and restaurants.
That concludes
Thank you.
today's press conference. Merci.
Ceci conclut la conférence de presse. Merci beaucoup.
Thank you.